Welcome back. It's Nurse Madi with another PNES PNEA video. First, we'll just clear the air. I know yesterday my hair was green. That was not the color I was going for, but I ran with it and it wasn't too bad. But today I fixed it. It's more of a blue color. You can't really see with the lighting, but it's more blue than green, so that's out of the way. I'm a little frustrated this morning. I've still been having a really hard time trying to schedule appointments with these different providers, and I'm just coming up shorthanded. Psychiatry has a 5 to 6 month waiting list. So that's a little frustrating, but at least I know I can ask my primary care provider to refill any medication that was started for me during my hospitalization, and I guess continue that until I can get in somewhere. And I did, however, make an appointment with a psychologist who specializes in PNES, who does the EMDR and psychotherapy and CBT. So never done this before, but I am looking forward to hearing what the therapy is about and how it might help me. I have read where some people have done it and have not gotten relief of their symptoms, and then I've also seen posts where people have done their therapy and worked on it and actually were able to return back to normal lives, that their seizures stopped altogether. So I'm a little hopeful, although mine didn't just start from stress, even though they say that's what it's from. I actually fell and hit my head and had a concussion, and for 3 days was vomiting and nauseous nonstop. And then on the 4th day, the seizure-like activity, as the providers would like to put it, began, and they kept continuing and going on. And throughout my entire hospitalization, which was a total of 11 days, but only 8 of those days I was having seizures, I believe we've counted maybe over 90 during that period, with still having seizures daily, but it's been a lot less. I've been resting. I've been taking the medication as advised. I haven't been under any stress, really. Yes, I have been diagnosed with depression and anxiety and PTSD. So those are also predisposing factors for getting PNES, PNEA. So that's a lot of people that this could possibly happen to at some point. So I think the awareness, we should definitely get out there. It's very prevalent. It's prevalent like multiple sclerosis, but it's infuriating how we barely know any information about it. Just no recommendations that work for some people and don't work for others. It's so vague, and I've been researching and looking at articles, and I mean, in 2013, this Dr. Ben Batis out of USF, Tampa, Florida, he called to action the American Psychiatric Association to say we need more. We need more research done. We need to know more about this disease diagnosis, and we need to start studying it a lot more. It's not even a diagnosis that is in the American Psychiatry Association handbook. There's a lot of patient information, but it's not even messaged. The whole disorder with functional neurological disorders and the PNEA and PNES and need patients, all these different neurological but also psychological issues, there's no real clean cut way to treat it. And there is not a lot of providers that even know or are familiar with this diagnosis. That is what is most frustrating. So if you're as outraged as I am and you would like change, please, I have a petition on www.change.org/PNES awareness. I'm trying to get enough signatures, so hopefully we can call the attention back and demand research be done and demand awareness to the public, to healthcare professionals and providers. And hopefully this way we'll be able to tackle this disorder and at least move it into the future, because right now it's stuck in the past. First episodes or knowledge of this go back to the 1980s, the late 1980s, but still, it's been around since the 80s, and we have yet to move forward into the future with our research. That's sad. Thank you for watching. If you like this video, please like it, share it. Thank you so much.